Good morning. I am Dr. LAKSHMI, fellow at Arvind High Hospital. Today my topic of presentation is evaluation of risk factors, association and visual outcome of posterior capsular lens. My moderator for the topic is Dr. Preeti Mohanty ma'am. Cataract surgeries are one of the most frequently performed surgeries in the field of ophthalmology, and the skill design is such that it needs to provide a speedy recovery along with a good visual outcome. And any complication can happen at any step which hampers this. Posterior capsular rent is a breach in the posterior capsule of the crystalline lens during the cataract surgery, which is one of the most commonly encountered intraoperative complication. The thickness of the capsule varies from 2 to 28 microns, being thinnest at the posterior pole measuring about 2.8 to 4 microns. The capsule is thicker anteriorly than posteriorly and at the equator than at the poles. The lamellar structure of the capsule gives it the elasticity which can withhold a stretch of about 60% of its circumference. These are the various types of capsular tears which can happen and which are classified based on the location, being pre-equatorial or post-equatorial, and sometimes it might be associated with an Argentinian flag sign, or sometimes it might be a punch PCR. The aims and objectives of the present study are to evaluate the risk factors and association factors of PCR, to analyze the intraoperative steps which are more prone for PCR, and to measure the postoperative visual outcome. My study was a retrospective case study done at a hospital during a study period of 6 months in 213 cases. Cases which had PCR intraoperatively during SSES or phaco were considered, and combined procedures or secondary IOL implantation were excluded. The data was collected from the electronic medical record, data regarding the demography, anterior and posterior segment findings, intraocular pressure, biometry, the type of surgery, intraoperative step complicating to PCR, and if there is any vitreous disturbance or secondary procedures done, and the visual acuity on POD 1 month were analyzed. These are my results. The age distribution was found to be high at around 61 to 70 years, and males and females were almost equally distributed, and laterality was seen more in right eyes, and the type of surgery more prone is small incision cataract surgery. Some associations we found in my study are 6 cases had a pre-existing glaucoma, 4 cases had iris coloboma, 5 cases had solar exfoliation, and some other associations involving include high axial length, microphthalmos, and exotropia and corneal scars. PCR in various cataracts, mostly seen in mature cataracts, brown and black cataracts, and others being hypermature, traumatic, and dense posterior subcapsular cataracts and posterior polar cataracts. These are the intraoperative steps leading to PCR. 34% was seen during cortical aspiration, and 33% during nucleus delivery, and 21% during phacoemulsification, and 12% during IOL implantation. About 79% had vitreous disturbance, and 21% did not have any vitreous disturbance. And the follow-up visual acuity was better than 612 in about 78% and worse than 612 in 22%. Discussion: elderly age group above 60 years have a thin and fragile capsule, making them more prone for rents. And in a high volume setting where majority undergo SSES, it is difficult to conclude whether which surgical method is more prone for rents. And some associations like high myopia have more axial length, which have an adherent cataract with a mobile and flaccid posterior capsule which has a trampoline-like effect, making them more prone for rents. Microphthalmos and iris colobomas have a shallow anterior chamber and zonular weakness which can cause rents. And pseudo-exfoliation, they have a weaker zonules along with a brittle capsule, weak bag, and sometimes pore dilatation can hamper the visualization during the surgical maneuvering. And corneal opacities have the same reason, that is poor visibility, which can make the maneuvering difficult. And sometimes in advanced cataracts and advanced glaucomas or phacomorphic glaucomas, they can have a shallow anterior chamber and with a higher positive pressure that can make them more prone for rents. And brown and black cataracts and mature cataracts have a denser nuclei with a weak and thin posterior capsule. Posterior polar cataracts have an adherent cataracts, and sometimes it might be associated with PC dehiscence, which can make them more prone for rents. Traumatic cataracts can have an underlying PC defect, which might be missed preoperatively, that can end up in a rent. Thank you.